Tebogo is set to discuss the recent attacks on two nurses at the Chuene Clinic in Limpopo. This incident has sparked urgent calls for improved security measures at healthcare facilities across the country. Tebogo, I appreciate your time. Now, what does this tragic incident say about the state of security in healthcare facilities in the country?
Good afternoon, Hugo, and also to the viewers of Newzroom Afrika. Look, this issue is not first incidents, because we believed that because the government have seen this before, they should have came up with measures to protect or to prevent this type of behavior from happening. But we keep on seeing this thing coming again. You know, we've seen nurses being shot at the hospital. You know, somebody comes and shoot and kill a nurse. And we've seen in other clinics, they came and raped. This is not a first incident. And we are worried because, you know, when you see this type of behavior, you need to come with ways in which you are going to protect or prevent this type of things from happening. But we see now that it happened again. And then who's going to suffer now? The community are going to suffer because of the failure of the government to protect the employees, its own employees, and also to protect the citizens. Because these nurses were busy dealing with the issues, the pregnant woman, but the man comes with a gun, and you know, it doesn't make sense. Where's security? Where are police and all those particular things? So there's a problem in our country. Well, and it really needs an agent approach.
Well, Tebogo, we know where the security were. The security were accosted by that same individual, and one of those individuals was force marched into the hospital by this perpetrator. Now, do you feel, or do you know if there are existing government policies aimed at protecting healthcare workers, and are they effective?
No, they are not effective. Look, our approach to this issue, we are saying as Save South Africa, you need to have an integrated approach where you don't exclude the police. You know, there must be that integrated approach. Even ambulances. I don't understand that how do we have a system or a clinic and then we know that the securities that are working there, they are not armed. And then it's common cause that we all know that. So why don't we have this integrated approach where if the police is some kilometers away from the clinic, at least there must be a mobile a station inside of the clinics and also other public health facilities, because this issue is not going to stop today or tomorrow as long as we don't come up with a way in which we will deal with the issue. So we are advising the government to say, have integrated approach, even the ambulances, bring this thing under one roof. So the problem that is currently happening in our clinics and so forth, it's poor town planning, where you'll find a clinic is 2 kilometers away from the police station. You'll find that ambulances and fire stations are 5 kilometers away. That can be. We need to have this under the same roof. They need to be in the same place so that when there's fire in the clinic, they're able to stop that. And also including even the schools. We need to have a plan in which all these things are integrated so that we can prevent this type of ill from happening, because the securities are not armed. And then we are told that they cannot arm because they're dealing with the issues. It's the government policy that they cannot arm. But if you say they must not arm, who must arm? Because we know that criminals are coming, and it's not for the first time. Criminals comes and they take medicines in other hospitals and clinics because the securities are not armed. They are hopeless. What can you do when somebody comes to you with a gun? You are going to surrender. So that is currently what is happening. And then we're not even thinking about the lives of the nurses and the doctors. We're also not thinking about the lives of the patients because they could have even raped the patient. So it's a call. It's a call that we are making to say, let us have integrated approach when coming to this issue.
Not entirely sure how such integration would work, having hospitals, clinics, and police services all in one place. But how do we separate the levels of crime in our communities to a singling out or the incident of violence or crime within hospitals or institutions within those communities? Because you're almost suggesting that whilst we have a huge amount of crime, crime is rampant in South Africa, that these criminals should then leave out these institutions such as hospitals. Surely the first port of call is how do we deal with incidents of crime in South Africa, because they're perpetuated across the country.
No, you are so right. The issue of crime is a problem in the country. I mean, we also made a call to the president to come up with a way in which to deal with this. We even suggested the state of emergency on crime, and then he refused. And then because we are saying every corner there's crime. So why can't we come with a way in which we'll redirect resources in dealing directly with crime? But the government refused to deal with that. But in this case, we are saying, because we're talking about clinics and public health services, we are simply saying, I get your point when you say, how will this work? But I'm saying it's going to be possible, because when you do your planning, you need to understand that here there's a school, it's a strategic thing. Here is the hospital, it's a strategic place, or a clinic is a strategic place. So who is going to protect these people? Because the securities will not be able to protect these particular people. So once you are able to answer that question to say, who is going to protect these people? The answer is the police must protect. So meaning that you have no choice, but you need to bring the police on board. What we are doing now, it's a problem. Even the issue of rape. When people go and go to a clinic and say, I've been raped, they say, go to the police station and open a case first. The person has to walk kilometers, especially people from rural areas. And along the way, they even decide not to go anymore to open the cases. So our call comes from that angle to say, when you have an integrated system, we know that it's just a click away and the police are here. And the patrol also plays a bigger role, because the police are not patrolling these particular areas because they think there's different areas. Now, and another point is that the security also in the clinics, it's also questionable, because when you walk into the clinic, it's just open there, anyone can enter. So we need to deal with such particular things, even apart from even including the police. You still have to deal with the problem within the structure. How you structure these particular buildings must also say something, because we are not expressing this for the first time. So you should be aware that when you build a clinic, you need to put security measures in place within before we even call the police to come inside.
Tebogo Mashilompane, spokesperson for Save SA, appreciate your time giving us his remarks following the unfortunate rape of those two nurses at Chuene Clinic in Limpopo.